Once the milk is in, the baby's eating well. So you're talking about a baby who's now 5 to 15 days old. They have what you would consider diarrhea, and that's normal for breastfed babies. So 5 to 10 very loose stools a day. Um, Fussy baby. Now, this is a tricky one. And normally when I do these classes in person, I show you how I hold a baby. But if you're holding your baby and it's 2 in the morning and the baby's quiet and happy, you put the baby down and they fuss and you pick them up and they're quiet, that's not a fussy baby. That's a normal baby. This is for the mothers. Um, your baby has been held every second of his or her life. That they hear your heartbeat, they hear you breathing, they hear you talking. When you walk, they sway back and forth, and they like it. So a lot of newborns like to be snuggled up and held against their parent a lot, particularly at nighttime. And there's just nothing wrong with that. It's just tiring as a parent. But let's say nothing you do calms the baby. Not holding them, feeding them, uh, rocking them, doing all the things you're going to try to do to make your baby happy. Your baby's crying day after day, more than 2 hours a day. You probably ought to talk to your pediatrician. Go and make a visit. First, we want to make sure the baby's gaining weight. If your baby's not gaining an ounce per day or more, your baby's probably not getting enough to eat. And that takes a trip to the pediatrician. They'll compare the baby's weight to the 2-week check. Babies can be sensitive to foods in mother's diet. There's all kinds of things that could be the problem. Milk and soy are big food allergens that can cause trouble in babies. So your doctor will likely take mom off milk and soy. If you're bottle feeding, there are formulas that are non-milk, non-soy also. Now, all babies spit up, so it's hard to be sure if that's what's causing your baby's pain. But babies do get heartburn, just like some of the wives in this class are probably having some heartburn from the baby pressing on the stomach. And so another consideration is heartburn pain. One thing I'm not a big fan of is gas. Now I know I have a mother, I have a mother-in-law, I have a grandmother, I have aunts and uh, older women who have opinions on how to raise babies, and they tend to all be worried about gas. And if we could just get rid of the bad gas, they'd be better. I'm not a big believer in that, but you can try Malecon or gripe water to try to help that. Now, all of this stuff we've talked about, particularly if you logged in a little bit late, you go to our website, planopediatrics.com. This whole talk is there. You can click on it and listen to the whole talk. Also, we have a baby book, which has all kinds of helpful information about all kinds of topics. We try to boil this down to a compact, concise talk because you guys have lots of things to cover this evening. We have a baby book on our website that has information on many, many topics, including visits and vaccines and all kinds of things. So if you missed part of the talk or you need more information, go to our website and take a look at our baby book or re-listen to this talk. Now we'll have time for a little bit of questions. If anybody has anything I talked about or didn't cover or wasn't very clear.
Do we have any questions for Dr. McDonald?
Yeah, I do have a question. So in the current environment with the whole COVID thing going on, how does the visits for the pediatrics work in the first few weeks when the baby's immune system is not as strong?
Well, we don't want your baby getting anything. I'm going to give you advice that has nothing to do with COVID. We don't want any baby under 2 months old getting anything. So forget COVID. If your 1 month old gets 102 fever, they're probably getting blood work, urine, a lumbar puncture, and being put in the hospital. So we don't want any child under 4 to 6 weeks getting anything. So we want to avoid sick people. That includes relatives. We want to limit who comes over. I'll be honest, when our children were little, we had grandparents, my parents and my wife's parents. And if they're well and you want to have them come over, but you can make them hand sanitize. You can not let them hold the baby. You can let them wear a mask. I mean, there are things you can do. But I don't think we want your baby getting exposed to anything in the first 4 to 6 weeks that's possible. Uh, should I get my vaccines? Yes. Your OB may have brought this up to your wife. You need what's called a TDAP, tetanus, diphtheria, acellular pertussis, because whooping cough for babies is normally caught from adults. And I would recommend your wife get it. Your OB will probably handle that. You can get it. And I would recommend your parents and any other people you expect to be around a lot in the first couple of months to get it. Good question.
Any other questions? Am I unmuted?
In that case, I'll let y'all move on to the rest of your class. You've got a big evening. Enjoy yourselves and get excited. Having a new baby is a wonderful experience. Y'all have a good evening.
Thank you so much. Thank you, Dr. McDonald. We appreciate you. Okay, can everyone hear me okay? Okay, you're going to want to keep the video that says Stephanie Armstrong host pulled up. And you can switch back and forth however you want, whether you want the presentation bigger or the video bigger, that's totally up to you. We ask that you hold your chat until we ask for questions, just so there are not background things going on, so that people can pay attention to what the presentation is. So we will ask several times in the presentation for questions. If you have a question, just write it down, hold on to it, and when we prompt for questions, we will get those answered. Once again, I'm Stephanie Armstrong. I am one of our childbirth educators here. I have been here almost 2 years now. I did, in the beginning of my career, I did labor and delivery, antepartum, postpartum, and newborn nursery, so all things baby. And I also, right now, am a school nurse. I've done high school, middle school, and elementary school. So right now I have 2 jobs, but this is my fun job. I also have 3 children. I have an 11-year-old, a 9-year-old, and a 3-year-old. So I was just sitting right where you are. I wanted to congratulate you guys and tell you how excited I am that you are here. I know this is not what you want to do with your Thursday night, but it shows that you are, you care about being a good dad. So we thank you for being here. We want to let you know that our mission statement is, above all else, we are committed to the care and the improvement of human life. And that is our goal here. That is every action. That is what we are striving for. So that is our mission statement. We're going to move right into what everyone wants to talk about, the COVID-19 stuff. Now, this class does not go into a lot of detail about COVID. If you have questions, we will get them answered, but we are going to show you this short little video just to let you know it's just an overview of what it looks like here at the hospital. And then if you have any other additional questions, of course, we will answer them. So we're going to get this video queued up. It's only about a 2-minute video, so just hang in there with us, and then we will come back on and answer any questions that y'all have. Yeah.
All Medical City Healthcare hospitals have a designated entrance for patients who are having surgery or procedure. Hi, welcome to Medical City. Our patients are met by friendly greeters who will take your temperature and ask some screening questions. So have you had a fever? For everyone's safety, our nurses, physicians, and all other staff go through this same process every day. After your screening, you'll be given verification, like an armband to wear. You'll also be provided a face mask and asked to sanitize your hands. Your support persons will go through the same screening process. Our facilities are vigilant when it comes to screening, limiting visitors, masking, social distancing, and sanitation. All surfaces throughout the hospital, including chairs, tables, and elevator buttons, are cleaned and disinfected regularly. As you head to pre-op a few days before your surgery, you may be asked to receive a COVID-19 test. This helps assure your safety as well as the safety of our caregivers. That was easy. On the day of your procedure, you'll be met at the door and brought back to surgery. Surgical patients are kept completely separate from patients with respiratory symptoms. The care teams are different too. Our caregivers are practicing universal masking, meaning everyone is wearing a mask. We also practice social distancing whenever possible, and we wear appropriate personal protective equipment. We wash our hands and hand sanitize before and after every patient. Here's one of our surgical suites. Our surgical suites are sterilized and spotless. Everything is meticulously disinfected before and after every operation. After surgery, you'll be taken to a recovery area where all the same stringent standards are adhered to by our colleagues and caregivers. Depending on your procedure and other factors, your physician or nurse will personally communicate an update either in person or via technology. Hey, how are you? From there, you are on your way to a speedy recovery. We'll be right there alongside you as you step back into your life. Medical City Healthcare. We're here to ensure you receive the care you need today for a healthier tomorrow. All Medical City Healthcare hospitals have a designated entrance for patients.
Okay, so I know there's going to be a couple of questions. This is I know it looks like a surgery video, but for those patients that are having an induction or a C-section, this is the process that even labor and delivery patients are following right now. So they will be asked to come in 2 days before. They will receive a COVID-19 test, nasal swab, and then they will go home and quarantine for that 48 hours before their date that they are supposed to come in, whether it be for a C-section or the induction date. Just moms are being tested. We assume that if mom is positive that you probably are too, dads, because of not social distancing from your spouse or your significant other, obviously. So we do not test support people, just mom. And then if your wife comes in active labor, she has the option to do this test, but it is not something that we do regularly for those that are coming in for active labor. So just those are the gist of things. You don't have to wear a mask in your room. You only have to wear a mask when you are in those public hallways, in the public places. We ask that you wear that mask that they give you on entrance to the hospital. On that note, is there any other questions that that are just bugging you about the COVID update? Okay, so I have a question. Where will I wait when my wife is in delivery? You are in the room with her. So there is a waiting room that's available that you can wear a mask and be there, but most dads or significant others will be in the room with mom. You will be her only support person allowed in the hospital at the time. So most dads, I haven't seen any in a long time wait in the waiting room while she's delivering. So hopefully in the room. Any other questions? Okay. Yeah.
As of now, it's still one support person with the mother, correct?
Yes, as of right now, we get updates daily, and so as things change, we will change our WebExes, but for right now, one support person is allowed with mom for the length of her stay. You can leave, but every time you come back, you will be retested, and you cannot alternate support people as of right now, as far as we know.
Will anyone be allowed to visit us while we are in the hospital?
No, it will just be that one support person with mom. We actually are, if mom is doing okay, whether she has a C-section or a vaginal delivery, the doctors are trying to get you out of the hospital as soon as possible. They're going to make sure you're stable, and it will be a discussion had with your OB provider and your pediatrician to make sure it's safe for y'all to go home. But we're going to try and get you out of the hospital and in your home space as fast as possible. But no, not at this time. We are not allowing any other visitors in the hospital other than that support person. And that's for to keep mom safe and baby safe from any exposure to additional people.
Do you offer gluten-free food in the hospital?
Yes, there are several menus. So no matter what kind of diet restrictions you may be on, there are several different menus that you can order from. There's a one general, easy, regular diet menu, but then if you have a special need like a gluten-free, there is a actual full menu that tells you everything that's gluten-free. And they have all different kinds. So if you need no salt, or you need you're diabetic or something like that, there are all different menus for the hospital that you are allowed to order off of. Anything else? Okay, so we are going to move on. Okay, so dads, I'm going to talk about before baby is born. And then Deborah, who you just saw on the screen, she's going to come up and talk about how you can help out when baby and mom come home. So here's the deal. You are needed, you are wanted, and baby needs you to be involved. So we're going to go over, the goal of this class is, I know during all our other classes, we focus on mom. And, you know, she's pregnant, we get that, but this class is for you. So we're going to try and talk a lot about how you can help and how you can be involved in your baby's life and how important it is that you are involved. So we're just going to start with the third trimester. Oh, yeah. Okay. We had another question, so I'm going to stop for a minute.
Do we still leave our vehicle in the drop-off area, or can we go park it and come in?
So if you come and you want to get your significant other up to labor and delivery, you have a little bit, 15, 20 minutes or so, a little bit of time to get her up to labor and delivery on that second floor, get her settled in the bed, and then go back down and move it. You cannot leave it in that pull-up area, but you can pull up and get her upstairs and then go back and move it. Anything else? Okay. Okay, so third trimester pillow talk. Pillow talk means the first thing about pillow talk is your significant other is going to need a lot of pillows right now to stay comfortable. You may not be able to find her in those mound of pillows. You can find pregnancy pillows if you want. They're big, huge, long pillows that offer support under the belly, under the head and neck, and even down, it wraps down in between her legs to support her hips and her knees. You don't have to have those though. If you have a lot of pillows in your house, you may just want to bring them all into your room and help her get supported in bed. And 15 minutes later, she may need to move. That is normal. But we all know that when she's comfortable, you're comfortable. So that's why we talk about that here. If you're not getting sleep, and she's definitely in her third trimester, probably not sleeping very well, then you are both going to be grumpy. So The pillows are a huge help. You don't have to have that pregnancy pillow, but you can if you want. Some people love them, some people hate them. Also, pillow talk, meaning we want you guys to have conversations. Know that your life is about to make a huge upheaval change for the better. But we want you having conversations. We want you as dad talking to baby, so baby gets used to your voice. They hear mom's voice all day long, and it's really cool when you get baby home from the hospital and they hear your voice and they turn because they recognize it. So read them stories, sing them songs. I don't care if you don't carry a tune. They want to get used to your voice, and you will love the reactions that you get as they get a little bit. You get them home and they get to where they can recognize and turn their head, and you'll love that reaction. So make sure you're doing lots of that. You'll want to help with cleaning around the house. Third trimester, mom's going to go back to being exhausted like she was during her first trimester. I don't know if everybody remembers that. So helping around the house as much as possible. Maybe when sit down and have a conversation, hey, what can I do to help make sure that things are taken care of so you can rest, just so that mom doesn't feel like everything's on her plate. That really helps. The nail salons are back open, so maybe you could go get a mani-pedi together just as an outing or a date night, or maybe you can just enjoy each other's company in the home and watch movies, do massage, whatever you want to do. Just take time for you and her at this time. You really want to over-communicate so that everybody is on the same page and that you have a good, strong basis into this big change that you're going to have. Other ways you can be involved, maybe pick up takeout on the way home so she doesn't have to worry about dinner, or cook meals. One of the things you might do is cook double what you would normally cook and stick it in the freezer so that when baby comes home, you'll have meals instead of having to try and throw together dinner with a newborn in the house. As a mom of three, I do know that is a bear to do, and those meal trains are lifesavers, or the frozen food in the freezer is really helpful. You can shop online, curbside pickup, baby store stuff, whatever you need to do to be a team and work together. So those things are great. Go for a walk, decorate the nursery. Being outside is really strongly encouraged right now for everyone. So going for a walk around the neighborhood is a great idea. But these are ways that you can bond with her so that y'all have a strong team going into this next phase of your life. Getting ready for labor and delivery. You want to make sure you pack for both mom, dad, and baby. And normally they say between 34 and 36 weeks, you're going to want to go ahead and pack. Dad, this is huge. It gets cold here in labor and delivery. Mom is running a marathon, and so that AC gets cranked down. And I don't know how many dads, when they find out I teach new dads class, come up and say, oh my gosh, let them know. Bring layers, it's so cold. Or bring peppermint just in case they need a blood sugar or snack, just in case your blood sugar gets low and you don't feel like you can leave. Those are the biggest things they tell me. It gets cold, even in the middle of the summer. So if you come in shorts and a t-shirt, you're probably going to be really cold. Maybe pack a pair of sweats, closed-toed shoes, a jacket, just so that you have layers. So if you get warm, you can take them off, or if you get too cold, you can put them on. Some dads even, we have blankets and pillows and things for dad when you stay. But if you'd like to have your own, a lot of dads really would rather have their own blanket. So those are just suggestions. You can bring pre-wrapped snacks in the hospital. So make sure you have snacks. A lot of dads don't want to leave the room. You can go down to the cafeteria. They have takeout stuff that you can get. And you also can order on the menu with mom. and there's just an extra charge for that. But you can do all of those things for food. You cannot order like Chili's or something like that and bring it in. They're not allowing that kind of food in the hospital right now. So those are your options for food. Mom can normally, as long as doctors say it's okay, she can have clear liquid. So you may want to pack a little bit of Gatorade or your clear liquid of choice. Nothing with food in it, no milk. And I would stay away from like juices and acidic things, tea, coffee, things like that. Because on an empty stomach, those can really upset mom's tummy. So anything clear she can do, but stay away from, just be careful what you choose, because whatever goes in can come back up. So just be aware of that. We do not have photographers in the hospital right now, so please make sure you clear off those phones and maybe bring your own camera and make sure you have your charger so everything gets charged. Make sure you have an email blast set up just because mom's going to say, hey, did you let this person know? And did you let this person know? And so just make sure you have all that, you've communicated all that together and it's all set up. One of the things you may want to pack for baby is things that you would want to have their picture of in the hospital. You definitely need one outfit for baby to go home in. Everything else we can handle. We've got shirts, we've got blankets, we've got diapers and wipes. So really and truly, you don't need much in that baby go bag, but you do want to have an outfit or two packed just in case. I had my first little boy, I think, spit up on his outfit 3 times before we left. So just have a couple outfits just in case. Other than that, everything else, we don't do more laundry than you need to unless you just want to. We have it all. If you have a special pillow you like, if mom has a special pillow she likes, bring those. Bring that boppy pillow if you have one, because the lactation consultants and our nurses can help mom use that boppy pillow and figure out how to support baby with the boppy pillow. The boppy pillow is most important in the first 3 months of life because baby's head is unstable and they can't hold their head up, and so that pillow helps a lot with support. Please make sure all your pillows are in patterned pillowcases, preferably not anything white. We don't want to wrap all your pillows up and stick them in the laundry. So please make sure those have different pillowcases on them. We talked about the change of clothes. You can stock your freezer and pantry for a week, easy. One of my friends sent me a basket of apples and protein bars and things like that. Honestly, those are the best because baby, you don't even realize how much time baby's going to take. Sometimes mom and dad forget to eat. So make sure that you just have those stocked in your house and ready to go. Install your car seat between 34 and 36 weeks. Know how to use it. We used to tell you to go to seatcheck.org and find somebody that can check that car seat. But right now, because of the crisis, they are not doing that. So that is not something that we can offer you. So we strongly encourage that you read your car manual and you read that car seat manual. This is one of those jobs that dads, that they feel like it's on their list to do, and they want to get it done right. Make sure you get it done right, because when we do studies and stuff, we put those car seats 80% of the time are not installed correctly. So I strongly encourage you to read those manuals. Some of the car seat manuals will actually even have a QR code that you can click, hold over and watch a video on how to install your car seat. So make sure you do that. There are a million different car seats with a million different, each car seat has their own set of rules on how to put them in. I know a lot of dads just say, hey, it's a car seat, how hard can it be? They have a particular angle that they have to be at based on your seat and your car and the actual car seat and what's safe. So please make sure you pay attention to those things. Labor and delivery. How can you be helpful in labor and delivery? We know, I know several dads that thought that labor and delivery was just their time to sit and watch TV. That is probably not a good idea. We want you to be attentive. That is the biggest thing. If I could tell dads anything, that is what I would tell them, is be attentive. Be there and having conversations, offering ice tips, just so she knows that you're not distracted and not paying attention, because this can be anywhere from average labor and delivery is 18 hours for first-time moms. And that does not include induction process. So mom needs to know that you're there and you're not going to leave. You're going to help her through it, because that is the biggest thing that they say allows mom to get through labor and delivery without getting discouraged, is having that good support system. And especially right now, you are all her support. You have your doctors and your nurses to help you, but you are her support person. So please make sure you are attentive. Be prepared, because her temper might get short. Remember, she is in pain or she's uncomfortable. So please make sure you are aware that that might happen. Be flexible. Sometimes moms come in with a thought that they want to do all of this without pain medicine. And sometimes it just takes an hour for mom to change her mind. You guys talk about it so that you're on the same page, but always be prepared that she's never been through this before, so she might change her mind. So you need to be flexible and be supportive, and know that she can change her mind. She doesn't have to decide ahead of time. She wants to probably think about it, so she's prepared, but she doesn't have to decide. She can change her mind when she gets there. Make sure you offer mom ice chips, popsicles, those clear liquids, as long as the doctor orders them. You can help readjust her pillow. She's going to be moving in bed, especially if she has any kind of problem with her labor or delivery or pregnancy. They may keep her in the bed, or if she gets an epidural, she will be in bed. So they're going to be turning her quite often to make sure that the baby's rotating down into the pelvis well. And so you want to make sure that you readjust her pillows, stay attentive, and help get her comfortable again when they move her. You can do gentle massage, but please remember that if you don't do gentle massage and touch her early on in labor and delivery, when you get to the hard transition phase of labor and delivery, which you'll learn about in our childbirth class, if you try and touch her then and you haven't touched her back here, she's not going to like it, and she's probably going to bite your head off. So please make sure this is a whole labor process, so it needs to be done from the beginning all the way to the end, and not just start at the end when she's really in a lot of pain. Remind her that you're going to stay with her. Remind her that she's beautiful and that you love her. It's very important to be supportive. Talk to her about the birth plan now, pain management. Whether if you're having a boy, are we doing circumcision? Do you want to cut the cord? There's all different things. And as we go through childbirth class, we normally hit on a lot of those points, but you want to have those conversations right now. So make sure you're having those conversations. Know that you cannot film from the waist down. No pictures and no filming from the waist down. No woman wants their bottom on Facebook or Instagram. So please make sure that is a hospital policy. It is not just a preference. That is a hospital policy. So make sure you know that. Careful not to get others in the background. Nurses, doctors, other people. Some people aren't wanting to be on social media. So if you want to take a picture with your nurse, or you notice someone in the background, please either ask them to move or make sure that they're okay getting a picture of them. And right now, of course, like I said, you are the only support person. So hang in there, be tough. Your nurses and your doctors are going to support you, and you be a great support person. We believe in you. We know you can do it. Okay, we're going to switch to Deborah. She's going to talk about postpartum, and then we might have time for skills, so we'll see.
Okay, well, welcome again. My name is Deborah Amerson. I'm another one of our childbirth educators here. So if you've been on any of the other WebExes, or childbirth or baby care breastfeeding or safety and CPR, you may have seen me. I've been a nurse about 18 years now, and my background initially was in labor and delivery and postpartum. And then once I had my own kids, I wanted to be able to stay home a little more, but still be with the same patient population. And education is one of my passions. So I came to this department right after my oldest son turned 1. So 13 years ago, I started teaching classes, and I've been here off and on during that time. My family moved overseas, and then when we got back, I decided I just wanted to come back to MCP. So thanks for allowing us to be here with you, and congratulations to all of you. So as you guys can see, this slide talks about skin to skin, and you can see that the dads on this screen are all bare-chested, and that the baby is down to either nothing or just a diaper. I find that dads don't really appreciate getting peed on, so that's probably, it's okay if the baby is in a diaper. But that skin to skin, actually having your baby's skin against mom or dad's skin, has shown in research to really improve bonding and to also have lots of benefits, both physical and emotional, for the baby. It provides a sense of security just laying against your warm skin. And if you're in a colder environment, you can just lay a blanket over the two of you. And so this is something that we encourage, not just for moms, it's for moms and for dads to do. And let me tell you, if mom is needing just a little bit of a break or some time, like we've been encouraging you to help take care of mom so that and encourage her to take care of herself, then maybe suggest that you could do some skin-to-skin contact. Moms really like dads who are actively involved and want to take an active role in helping to care for the baby. So I highly recommend that you do this starting from day one. You can do this as soon as mom will let you after that, after the baby is born. All right, so for the postpartum period, beginning in labor and delivery right after the baby is born, first of all, as soon as the baby is born, dads, Stephanie already touched on it, but you will be given the option, and this may be something you've already discussed with your OBGYN, but you will be given the option to cut the baby's umbilical cord. And really, it's more of a symbolic thing. They're going to clamp the cord close to the baby, and they're going to clamp the cord on the mom side. So there'll be two sides, and the doctor will make it real easy and just point right where you're supposed to cut. And I've heard dads say that it's kind of like cutting a water hose that has been coated in KY jelly. It's really slippery and it's kind of thick, so it usually takes a few snips with the surgical scissors that they'll give you to do that. But it's a really symbolic and really meaningful thing for dads to do, to be the one that officially cuts that cord. So you don't have to do it. It's not a requirement, but they will talk to you about that and give you that option. So be ready, because things tend to happen really quickly the moment that that baby comes out. And then once that happens, almost immediately, as long as everything is going well, there'll be several nurses or people in there to help do all these different things, so it happens really quickly. But we will put a set of printed ID bands that all have the same 5-digit printed number so that the bands all match. Mom will get one on her wrist, baby will get one on his or her wrist and ankle, and then support person or dad, whoever the support person is going to be for the duration of the stay, you will also get one. And what that does is, if the baby leaves you and goes to the nursery either for a procedure or for whatever reason, then when they come back, we're going to check the ID band that the baby has on to either mom's or dad's ID band. So dads, if you do leave the hospital to go home, let's say they'll let the dogs out, and then you come back to the hospital, make sure you get a shower. You're going to keep that band on. Don't try to cut it and take it off or undo it. It's not going to come back on, and we cannot print a new set of those for everybody. It has to be the same one. So make sure to keep that band on until everyone is, mom and baby are both discharged from the hospital. In addition to that, we're going to put kind of like a little baby low jack on the baby's ankle. This is a little security, kind of an alarm to make sure that the baby doesn't leave the hospital without mom and dad. And so we'll deactivate it before mom and baby are discharged from the hospital, but only moments before they're going to leave. Our second floor unit, where labor and delivery, nursery and postpartum, and NICU all are, is a locked unit. So anytime a door opens to come into that unit, if a baby is near that open door, the alarm is going to go off so that nurses or someone will be there to observe and make sure that it's not someone trying to get out of the hospital with a baby. And then once the baby gets within a certain proximity to mom has it's a two-part system, so that's why we call it the hugs and kisses. So mom has another part of that, and so as soon as baby is put into a certain proximity, several feet within mom, it'll make a chime telling us that this is the right mother-baby couplet. So after a vaginal delivery, with every delivery, we encourage skin-to-skin contact. And so dads, you can be an active part of reminding mom she's going to be physically exhausted, and she may not remember all of this, or she might. But just make sure to encourage her to have that skin-to-skin contact with the baby. The nurses right away are going to put the baby on mom's chest and let mom and dad both have an active role in getting the baby dried off and nice and warm, and getting to have that nice full head-to-toe look at your baby for the very first time. And then encourage mom, remind her about that breastfeeding within the first hour of life. As long as mother and baby are both doing okay from the delivery, baby's vigorous and breathing and crying, then we're going to try to get the baby to the breast within that first hour to promote breastfeeding success and to get mom's milk coming in as soon as possible. With a C-section delivery, mom can still do that skin-to-skin contact. After the C-section, she will go to a recovery room in the labor and delivery area, but just right outside the operating room for the C-section. And she'll stay there for a few hours, a little bit longer, just because we'll monitor her vital signs and things like that, just for a little more closely before sending mom and baby to the postpartum area. So. But she can still do skin-to-skin contact with the baby, and if not, then dad should be able to do that as long as the baby is okay. And then we can still, as soon as mom gets into the recovery room, then she can go ahead and try to get the baby to the breast within that first hour, maybe 2 hours. And then for vaginal delivery, after 2 hours after the birth, as long as everyone's doing well, then we gather everybody up, and dads, here's where you're important. We need you to get the bags and help load everything up on kind of a little hotel cart like they have at hotels, and escort mom and baby, and the nurse will take you guys all over to the postpartum side, just on the south side of the hospital. And for a C-section, it's just maybe another hour to 2 hours, depending on how everything is going, and then you'll go to that postpartum room. And nowadays, we're kind of delaying the bath. That used to be something that was done right away within the first couple of hours. So maybe after 1 hour, the baby would go to the nursery, and the nurse would do an admissions assessment and do that initial bath. But we're kind of delaying it a little bit longer, finding that it helps for babies to be able to regulate their temperature a little bit better before we cool them off with that bath. So dads, I know my husband, when we had our first one, had never seen, or maybe he had at that point had seen one newborn, but he still wasn't quite ready for what to expect. So if we were able to have you guys here in the hospital, then we usually like to bring a newborn. The dad brings the newborn in and lets you guys see. But since we can't, we have kind of the next best thing, just a couple of pictures. So you can see on these pictures, I hope it comes through, the babies are both kind of coated, especially the one on my left. It's kind of coated in like a cream cheesy substance. So that is called vernix, and the baby is coated in that to sort of protect their skin from that amniotic fluid. You also may notice that that baby on the left has quite a misshapen head, and that is one of the things I have heard dads comment maybe the most about is my baby's head gonna stay this way? It's shaped like a cone, and I've heard dads really be concerned about that, especially on day 2 when it's still maybe a little bit like that. Babies, the plates in their skull, those bony plates are made to kind of mold together so that the baby can come through the birth canal and so that the baby's head can kind of shape a little bit as it comes through the birth canal. So that baby has been in a vaginal delivery and has spent some time in the birth canal, and that's very normal. It takes a couple of days, but then usually by the time you're home or maybe the next couple of days, that misshapen head will go back to a nice rounded skull shape. Usually it's not even noticeable because in the hospital we keep a cap on the baby's head for the most part because mom tends to be really hot-natured because of the fluctuation in all of the hormones after delivery. So we tend to keep our rooms really cold, and if you've been up here recently, but the hospital hallways are freezing as well. So anytime that we try to keep the baby's head covered with a cap, and once it's covered with a cap, you don't even notice that molding. And then you can also see the little yellow clamps for the baby's umbilical cord. So that's what a newborn looks like. Any questions so far? So after, I'll continue, and if you guys have any questions, Stephanie will ask them once I kind of get to a break. So once mom and baby are in the postpartum side, then our priority as nurses and anyone who's assisting and supporting mom, our priority is to encourage and assist her with breastfeeding and with resting. Babies eat around the clock, like Dr. McDonald mentioned. They eat every 2 to 3 hours, and they don't really regard nighttime at all. So every 2 to 3 hours around the clock, mom is waking up, baby is waking up, mom is sitting up to feed. And in those first couple of days, really the first couple of weeks, she's really learning how to breastfeed. And so you being there and really being a cheerleader, and like Stephanie said, not just pillows in the pregnancy in the 3rd trimester, but lots and lots of pillows are needed with breastfeeding. Even if mom has one of those Boppies or My Breast Friend nursing pillows, babies, initially, newborns are so small that a lot of times we need other additional pillows stacked underneath that breastfeeding pillow. And so the nurses here, observe them, come and help them with positioning those pillows so that when you get home, you'll be able to continue doing that there as well. Help her to wake the baby, because sometimes it's time for her to wake the baby. It's been 3 hours since the beginning of the last feeding, and we're going to tell you, okay, you need to go ahead and wake the baby even if they're sleeping. So mom is going to need to take care of herself and go to the bathroom and things like that. So make sure that you are involved as well, not just saying, well, I can't feed the baby. You can still be a really active participant in this. So help her to wake the baby. So if the baby's all nice and swaddled, undo that swaddle, pick up the baby and start talking in a soothing tone to the baby. Maybe change the diaper, feeling that cool air will sometimes wake the baby up. We need them nice and alert so that they can feed, but sometimes we have to get them to that alert state. Encourage mom, remind her that every time that so maybe once you've woken up the baby, mom's gone to the bathroom, she sits down and she's ready, you've gotten her all positioned with all of her myriad of pillows, then look at her water, look at her snacks. Like Stephanie said, always be attentive. And so make sure, after does she need something to eat? We tend to get hungry and thirsty in the middle of every breastfeeding session with the baby. So, notice if she needs some water, if she needs a light snack and something like that. Then in between sides, you may need to change the baby's diaper. Sometimes the initial filling of their stomach on the first breast will stimulate their reflex, and they'll actually have a poopy diaper. And so you may need to change that poopy diaper, and that will help to wake the baby up again so that they can fully nurse from the other side. We want to try and nurse from both breasts every feeding. You can burp the baby, and again, this is something you can do before or in between breaths or at the end of the feeding. Once, you take the baby home and you guys are given the first bath, whoever does that, you're going to need both of you there, because that first time it's just really awkward figuring out, how do I hold this baby? What do I need? And we almost always forget something that first bath. So just being there, even to be a set of hands or to take pictures or video of that first bath at home. And then if baby is bottle feeding, then of course that is another way that you can be a really active participant in helping to take care of the baby. Okay. I think we're going to have Stephanie ask a few questions. Give us a minute.
Can y'all hear me?
Yeah.
Okay. We had a question a little bit earlier about my wife was wondering what active labor was. We would strongly encourage that you come to our childbirth class for that and answer that question. It's a long answer, there's a long answer to that question. It's several phases. So we are, it can be, like we said, 18 to 24 hours. So hang in there. But definitely go ahead and sign her up to that childbirth class. That would be a really good class for her to take if she has questions about that. We also had a question about if his wife is positive for COVID-19, will he still be able to be with her during the C-section?
Yes, as far as I know, she is COVID-19 positive. You can be in there. Again, we are going to assume, partner, that you are also COVID-19 positive just because of the impossibility of being able to social distance as a couple. So we will use the same precautions regardless for both of you. But yes, you will still be able, as far as I know, to be in that C-section with her.
We had a question about pillows. Is there a limit to how many more we can get? Will the hospital have lots of extra pillows?
Yes, when I worked on the postpartum floor and also in labor and delivery, we almost have an endless supply. I've never seen us run out of pillows. So if you need 20 pillows in your room, we should be able to get you 20 pillows. Now, if every patient needed 20 pillows, that might start to become a problem. So just make sure, if you're needing them, then that's fine. Yeah, so I've never seen this run out.
If we are going to be bottle feeding, will we need to bring our own formula or will the hospital provide that?
The hospital does provide formula for you. So if you are planning to bottle feed your baby from day one, then we will have that here for you. We also have the nipples that are appropriate for newborns. So yes, and the nurses, there's kind of, some things to kind of know about bottle feeding and the angle to hold the baby and things like that. So we will still kind of walk you through that process. But yes, we will provide the formula that you need while you're here in the hospital.
How long does it take for the umbilical cord to fall off?
That's a good question. It can take anywhere from 5 to 10 to, sometimes 14 days, but it will start drying up, and by the time you go home, it'll be no longer like moist and squishy. It'll be more just like a dry, almost look like a scab. And the most important thing with the umbilical cord is just trying to keep it dry as much as possible. And they used to say use alcohol, but we do not tell you to use alcohol anymore. Just make sure that the umbilical cord is not covered up by the diaper. So sometimes we have to fold that diaper down. Shirts and other things are fine. It doesn't tend to bother them. So we get lots of questions about that, but it doesn't tend to hurt them. And then once it comes off, you might see a little dot of blood, as long as it's not oozing or showing any of those signs of infection like redness, swelling, warmth to the touch, or any kind of discharge, then it's fine. And again, you're going to have, like Dr. McDonald said, you're going to have lots of visits with the pediatrician. You're going to have one just a couple of days after you go home from the hospital, and then another one at 2 weeks old. So, and then, if there's any concerns in the meantime, in that week and a half or so, then they'll see you back if there are any problems. But yes, the doctors will kind of keep an eye on that as well.
Are there any particular snacks that are good for mom to be eating while she's breastfeeding or whatever?
So while she's breastfeeding, really nutritious snacks, fruit is good. Granola bars are good. Anything, it kind of needs to be stuff that she can eat with one hand, because it usually takes at least one arm, or dad. I've even seen dads sitting there holding snacks for the breastfeeding mom. And so, apples are great. Anything that you can kind of eat while that baby is on one side, like 10 to 15 minutes. I don't recommend a full meal, but just snacks like granola bars, things that are really just anything that's going to give mom, just a few extra calories. It doesn't have to be a big snack, but nothing in particular really that I can recommend to you, but it's just anything that, that is healthy. And you, like Dr. McDonald said, if you seem to notice that, dairy or something like that seems, when mom has a high intake of dairy or something like that, then you may want to consider, limiting those kinds of snacks like yogurt and string cheese or milk. But other than that, there's really nothing in particular, just whatever is handy and easy. But like Stephanie said, having people bring baskets of snacks that are quick, that mom can just eat real quick while she's breastfeeding, packaged granola bars, apples, bananas, those tend to be pretty easy for her to eat.
We had a question about circumcision after the baby is born. The circumcision is done by your OB provider, and normally before you leave the hospital. If you have a different preference, you will want to, you won't be able to use your OB provider for that circumcision if you don't want to do it in the hospital. So if you want to wait and delay that circumcision, you actually have to see a urologist to get the circumcision done if you want to delay it. But normally it's done before you leave the hospital. If you have any other questions, you'll want to talk to your OB provider about that circumcision. Also, we had a question about some people eating the placenta. That is not done very often. And I don't know if we even allow that at the hospital or not.
You are allowed to keep your placenta if you bring a container for the placenta. Now that's assuming that everything goes like it should and there are no issues with mom or baby afterward where the placenta needs to be sent to pathology. But if you bring a container in and everybody is healthy after delivery, then you are allowed to take that placenta.
We had some questions about what to bring along. Yes, if you have a CPAP and you need to bring that. Moms, if you have a pump and you want your lactation consultant or your nurse to show you how to use your pump, bring your pump. Moms cannot eat during labor. The snacks are, and you can order snacks for postpartum for mom and dad. That can be done through, the snacks are included in mom's meals. So there will be some snacks offered. But dads, if there's anything particular that you want for snacks, that's kind of what we were talking about. Dads need snacks for labor. Moms need snacks while they're breastfeeding afterwards. So that's what that's about.
Mm-hmm.
Are there any other questions before we move on? I want to make sure we get to the rest of the presentation.
I could hear you. No, I could hear you. Oh, okay. All right, well, let's keep going. All right, and then also, again, encourage mom to rest. So kind of the nice thing, I don't want to say it's nice right now that you're not allowed visitors, but Dad, it is making your job just a little bit simplified because you don't have to, what I always tell dads is you are kind of the gatekeeper for mom. You have the say after you talk to mom about who gets to come and go. But of course, we've said it already, no visitors in the hospital besides Dad. You can have Dad or, whatever support person mom chooses. Dad, if that's you, then you are here for the duration and no one else in addition to you is coming in. So I used to say, Dad, you're responsible. So if that visitor policy, let's say mom is due 3 months from now, I don't know how long this is all going to last, but let's just say in 3 months from now, if the visitor policy has changed, then Dad, and that's when your wife is due, then Dad, you are the one responsible for dictating who gets to come and when. And so I'm going to kind of talk about that bottom point there. The serenity time in the hospital is from 2 to 4. This is throughout the hospital. And so it is kind of like an afternoon siesta. Everyone is the nurses will come just before that 2 o'clock time, check on their patients, and if you need something, they'll make sure and meet that. And then, of course, if you need your nurse during that time from 2 to 4, you can always get a hold of your nurse. Just they are not going to come into your room to bother you during that time unless you explicitly ask for it. And then until 4 p.m. So maybe, Mom, you can try to feed the baby before that time so that then everyone can just have some downtime and quiet time, because from early in the morning in the hospital, you have the lab coming in to check Mom's blood. You have people coming in to deliver the meals. Doctors tend to come in pretty early to talk to you before they go to the office. So it's kind of like a steady stream of people in your hospital room, hospital people in the morning. So after you guys have lunch, then it's a nice time to kind of prepare to be able to rest from 2 to 4. Now, of course, that doesn't really apply in labor and delivery. That's its own separate area. But in postpartum, you guys can try to rest during that time. So plan that. And then, again, like I said, if we have opened up to visitors by the time you come to have your baby, make sure to let them know, hey, there is a time in the hospital when we would like not to have any visitors so that we can get a little bit more rest. All right? So going back up to that top point, the celebration dinner that we have in the hospital is just a really nice way for you guys to both celebrate. Now, that is a time when the dinner tray is supplied for both Mom and for Dad. So you don't have to pay extra. That is provided with the whole fee for the hospital. So make sure to take advantage of that. But Dad, don't get too excited and eager and order that before it's time. So make sure that if Mom has had a C-section, that she is allowed that for her diet. So if Mom is not sure, then just make sure and ask the nurse before you call to order that. And remember that the last time you really want to call to order your meals during the day is about 6:30, because the dining room closes at 7. And so it takes about 30 minutes usually to get your meals. So Dad, that's another thing. Just remind her when it's time, maybe 30 minutes to an hour before, that she needs to be looking at her menu and getting ready to order those meals. And then order snacks for the middle of the night for both of you. And walking is a big part of recovery. And right now you may be leery to get out in the hospital hallway. The only thing that we ask is that you wear a mask when you get in the hallway. So we encourage Mom, you guys to walk in the hallway for recovery. But if you want to just make little loops around your room, that's fine too. But Mom may need to be encouraged to do that a little bit. Just be careful, Dads. I've noticed that dads tend to get really eager, and you're feeling fine because you didn't just have a baby. And so you're going walking with Mom, and she might be showing signs that she's slowing down or that she's not feeling so great. Let's say she had a C-section. Look for those signs when it's time to turn around so that Mom doesn't get too tired out or get into too much pain. And then once you go home, you need to, and this is going to happen in the hospital too. Most likely she's going to have a lot of ups and downs with her emotions because of those postpartum hormones. And so the one piece of advice my husband tells every dad that he knows is a new dad, he's like, okay, there's going to be this moment after she has the baby when she's going to be sitting there and you're going to walk in and you don't know what you did, but she just starts crying. And it's happened to every other mom that I know. We're just sitting there. We don't know why we're crying. Just it kind of happens all of a sudden. Sometimes we're overwhelmed. Sometimes we're just sitting there and really we have no clue. So that's pretty normal for the first couple of weeks. Postpartum blues hits about 80% of women, and it's just going to look like maybe she's a little bit more emotional or, just having trouble with just that first couple of weeks. She may feel not quite herself. But after about 2 weeks at home, she should start kind of turning a corner and looking a little bit more like herself as far as her personality and eating and things like that. Postpartum depression is more severe, and it occurs in about 10%, it may be 8%, 8 to 10% of women, and that's going to be after that first 2 weeks at home. And you're going to see things like she's not wanting to take care of herself for long periods of time. She's not wanting to take care of the baby, or she's overly obsessive about the baby. Anything that doesn't seem to kind of meet maybe a happy medium, and it goes on and it's just very emotional, up and down. She says things about that she's not a good mom, and if this is the pattern that you see more often than not, then that is a sign that things are going more into postpartum depression. She's not feeling like getting out of bed and taking care of herself, sleeping either way too much or way too little. So anything that's kind of in the extreme, those are signs of postpartum depression. And mom is not going to realize that it's happening. And so dads, this is where you are vital to helping to look out for those signs and help her to realize it's time to get help. It's time to call the OBGYN and seek some professional help for this. And then psychosis is, of course, even more extreme and more severe. It's very rare, but it can happen. And in these instances, mom may be talking about hearing voices. She may be talking about harming herself or harming the baby. So things like that are big time red flags and definitely time to seek help. And then the next thing I want to talk about is shaken baby syndrome. And so shaken baby syndrome is something that babies are at risk for up until the age of about 2. And the reason that they are at risk for developing this is because, for a few reasons. First, their brain is not fully filling up the space inside their skull. So there's a little bit of room for it to move around. And so I'm going to, I don't want to get too far away from, I'm going to bring let's see, should I just bring it right here? Okay. And so can everyone still hear me okay? If I come up here. Okay. So the brain is not fully filling up this skull. And I have this model of a baby where you can kind of see inside that skull. And you can see that that brain is not fully filling it up. And then as I shake this baby, I want you to listen and you'll hear a click. And that sound, and you see I didn't really shake the baby even that hard, but that brain is moving around and kind of slamming up against the inside of the skull. And babies' heads are much bigger in proportion to the rest of their body than ours are. So their head is the heaviest part of their body proportionally. And then the other thing that contributes to shaken baby syndrome is that their neck muscles are weak and not yet strong enough to have to support this head upright. Just think, they've been cushioned and swaddled and held nice and tight and firm inside mom's womb this whole time. So their neck muscles have some developing to do before they can really fully support that head. And so babies are sometimes shaken in frustration. So recognize some signs in yourself and in your partner of being frustrated as a baby and take turns. Make sure you're supporting each other before you get to that point of being frustrated and shaking the baby. But also for dads, playing with the baby is probably the biggest activity that could potentially cause shaken baby syndrome. So the number one thing that I know my husband couldn't wait to do with our babies when we had them was to take the baby and throw them up in the air. And I don't know if that comes across on the sound. As the baby comes back down, you can hear that brain hitting up against the skull. And so dads, just be really cautious when you play with the baby. You can still take the baby and let them come up and down like this, or you can support their head and they can be Superman going around the house. They think that is great too. There are lots of ways that you can play with and have a good time with your baby without causing a potential for them to have shaken baby syndrome. Okay, any questions before we move on?
We had a question about whether popsicles are in labor and delivery. Yes, we do have popsicles in the freezer, but there is not, in most of HCA hospitals, there are not a refrigerator freezer in every room. We have snack stations that have ice, and water and tea and coffee, a little bit of juice, maybe some peanut butter and crackers for dad. But that's all they have in labor and delivery. But they do have some popsicles in the freezer. Some are sugar-free, and so please don't take the sugar-free ones unless you have to have the sugar-free ones. Those are for our diabetics. But yes, we do have them in labor and delivery. Are there any other questions?
So Tiffany is going to come up and talk real quickly about kind of interacting and adventures with your baby. And then I'm just going to leave this slide up here. This has our phone numbers for our office where you can call, and also the email address for registering for any other classes. And I did want to mention real quickly, I wrote down the dates and I failed to mention those to you guys. But we have our next, just because we were talking about burping and things like that, and we have our next baby care and breastfeeding class is going to be June 27th. We do breastfeeding in the morning at 9:30, and then at 11:30 to 1, we have our baby care class. So dads, I also highly encourage you to attend those classes with mom. So it's always good to have two sets of ears hearing all the information because it's all brand new, I assume, for both of you. And then we do have an infant safety and CPR class where you can actually come to the hospital and pick up a kit with a practice mannequin to practice CPR on an infant. And we do go a lot more into detail on how to keep your baby safe. So I do want to recommend those. That safety CPR class is on June 3rd, so about a week and a half from now, in the evening, 7 to 8:30, same time as this class. So I'll be here, Stephanie will be here, so we look forward to seeing you at those classes, and she's going to come up and talk to you a little bit more.
Okay, we normally have a really fantastic video that we show you about this point, and it is not coming across. So we are going to just talk a little bit about it, and then Deborah and I are going to, if time allows, we'll do a few skills just as a review. So just real quick, we have an employee of the hospital that studied to be an anthropologist, and she does a lot of studies on how dad and mom, how their differences affect babies. And there is a lot of research done that actually shows that mom's interactions with baby develop a lot of different dendrites in that baby, creating all different growth in neurons and connections and things like that that help them start to learn even at a very young age. And a lot of people really focus on that. But lately, they have done more research on how dad and what he does with babies affects that neuron development and that baby and that growth. So moms is normally a caring, a gentle, how do I deal with just certain things in life, and then dad tends to be more of the fun, exciting, hey, I'm going to die. One of my favorite things that she says in the video is she shows a picture of dad dumping water on baby's head, and baby sputters and splashes and says, oh, they just look startled at first, but then realize that it was fun. And so one of the things that's developed in that is baby realizes how to deal with the unexpected things. So there are wonderful things that come from mom's interactions, but also it's so important for dad to do some interactions with baby. And there are different neurons and different dendrites develop in that process when dad plays with baby. So we don't want you to play with baby in the same way. Dad, do what feels and comes natural to you. Just stay safe, like we talked about with playing with your baby. Mom, do what's natural to you. But know that both of those things have an effect on your baby. And in the long run, allow your baby to develop wonderful skills, life skills, later on in life. It develops language skills. It develops problem solving, all kinds of things. Social interaction, all of that starts as a young infant. So we want to make sure that dads, you're getting involved and you're getting in there and taking them to the grocery store, or putting them in a front couch and walking around the house and talking to them. Just like we talked about earlier, your voice is really important for them to get to know you. So we really want to encourage those outings and that one-on-one time with baby, just because what you do matters, and we want you guys to know that. So if that is the summary gist of things, unless Deborah, you can think of something that I missed, we are going to do a couple skills, if that's okay with you guys. But if there are any questions you have right now about anything that we went over before, now would be a really good time to ask those questions, and then we can move on and touch on a few skills that you will review again in baby care.
How long is mom in postpartum?
Okay, so that is kind of a tricky question right now, but with the COVID stuff, we're normally saying mom, if we can get mom out, if she is good and everything is going well, and mom and baby and doctor and pediatrician agree, mom will be home within 24 hours of delivery. For a C-section, if everybody does well and everybody agrees it's okay for mom to go home, we actually try and get her home 24 to 36 hours after delivery. Before the crisis, things were different, but that is what they're saying now. The less amount of time that you guys are in the hospital, the better. So if there is that, hopefully that answers your question, but for right now, that is the deal. Okay, so, oops, I'm not meaning to suffocate my baby, sorry. Okay, so we're gonna go over diapering really quick. A couple things you really wanna remember, dads. Diapers, there are all kinds of things to remember. Some babies, the diapers, different diapers, brands of diapers fit them better than others. So we don't recommend diapers because it's gonna be different. Every baby's gonna be different. You might get a small thing of a couple of different brands and see which diapers fit your baby the best, because the better they fit, the less mess we have. And if anybody's like my husband, you hate messes, especially when it comes to pooping and peeing. So you might want to do that. Great little tips about diapers. They now have a yellow line on the diaper. I don't know if y'all can see that. If that yellow line turns blue, it means that baby is wet. You no longer have to stick your finger in the diaper to find out if the baby is wet. If that line turns blue, the baby's wet and can be changed. Pooping, you can smell. If they stink, probably go ahead and change it. What else? Oh, there's a front and back label. So you don't have to put it on backwards. There's a front and there's a back. So make sure you look at that, dads, when you're changing diapers. These ruffles that are on the diaper, I don't know if you can see them. Make sure they're out because they help keep poop and pee in. So make sure they're all pulled out. What else about diapers? Oh, so babies, there's different sizes of diapers. The sizes go by weight. So make sure whatever brand you decide to use, you look at the weight, and that will tell you what size of diaper you should have for your baby at that current time. Couple ways you can tell if your baby's ready to move on to the next size. If they continue to have blowouts, meaning the poop goes all the way up their back and up to their neck or out the side of the diaper, that might mean it's time to change. If the diaper doesn't go up to right below their belly button and right above their hips and their back, then it may be time to change. So just know those are some tips on diapers. What else? Diapering. Make sure you have everything in front of you. You want to have an extra diaper and an extra set of clothes. You want to make sure you have anything. If you have a circumcision, you want to make sure you have all of those. If you have any dressing changes or ointment or anything you need to put on them, make sure you have it with you. You never want to turn with your back to that baby because you will never, it always happens. All of a sudden they can roll over when you turn your back. You may want to have diaper rash ointment. You do not have to use it every time. And baby care, we talk about how to recognize a diaper rash, but make sure you have everything you need right here. You'll want to go ahead and take a couple wipes out, shake them out, because it never fails. You forget to take your wipes out, and you try and get one out of the package, and you end up getting 10 instead of just 1 or 2 that you need. So I normally get 3 or 4. I set them on top. I open this diaper up, and I turn baby sideways with my dominant hand doing the diaper changing. So I'm right-handed. I'm going to have the diaper on my right side. So you just unlatch the diaper. Most babies start with diapers on because your nurse helps you put your first one on in labor and delivery. So most of the time we start with the diaper on. I use this diaper as my first wipe. Always, boys or girls, you're going to want to wipe from front to back. So I take that diaper and I wipe from front to back with that first diaper, first wipe. Boys, if you have a boy, you want to make sure when you take that off, you cover that penis right back up, because when the cold air hits that penis, they're going to pee, and that's how most parents get peed on with boy babies. So make sure with boys, you take it off and you put it right back on. Let them pee in the dirty diaper. It's not going to hurt anything. So again, we use that first wipe, and I'm going to try and do it fancy. And I tuck that diaper right up underneath that bottom, and this is where I put all my dirty, okay? All my dirty wipes and everything go right on top of that, the top of that diaper. So I take my first wipe. I'll wipe from front to back in the center. If you have more clean, you just fold the wipe to where you have a clean area, and you can use it again down the side, fold it again, down the other side, and then use your wipes until baby is completely clean. With boys, make sure that you clean under that scrotum. With girls, it is so, so important that you wipe front to back every single time, because their urethra, where the pee comes out, is right near that anus, and that all that poop can get up in there and cause a urinary tract infection. That can happen with boys and girls, but girls especially. So we want to make sure we're wiping from front to back. So then once I have all my dirty, I fold my diaper up and I throw it in the trash, wrap it all up, and it's all contained in one little diaper. Then we have the new diaper already pulled out. It goes underneath, and about halfway, you're going to fold it up, and you're going to tighten this strap to where you can fit maybe one finger down in there. You don't want to be too tight to where it is leaving lines on your baby, but you don't want it to fall off either. So we normally say about one finger fit down in there. Really quick, a shirt, so she can go over swaddling with you and burping. So with a shirt, these extra wide sleeves with the overlapping sleeves or a button, they're great, because then you don't feel like every time you're undressing your baby, you're ripping their face off. So if you take that shirt and you gather it up, your baby's going to be laying on the changing table or on the bed next to you, or whatever you're doing when you're getting them cleaned up. So you'll gather that shirt and put it over the baby's head, just like so. Sorry, it's hard to do with one hand. And then you take your sleeves and you gather it up just like your wife would with a pair of pantyhose or something like that. And you put that arm through and you gently grab it and pull it through. And then you do the other side the same way. The great thing about these shirts is if the baby has a blowout and the poop goes up the baby's back, these can be pulled down so that you don't have to pull poop over the baby's face. So these can be pulled down and off. They can also be pulled up if you want, but that's one of the great things, because I know we talk a lot about poop, but there's a reason. So that is great. So Deborah's going to come up and do real quick swaddling and burping, and then we will be done. Be prepared with questions in the chat if you'd like, and then we'll get those answered.
Okay, so we're going to swaddle the baby, and then I'll show you a few different positions for how to burp the baby. So for swaddling, the best blanket is one that is pretty big and square. So you can see this one covers me kind of from like head to just the tops of my thigh. So it's pretty big and it's square. This is one like we'll have in the hospital. A lot of the receiving blankets you get from baby stores might be a little bit thinner, but as long as they're square, you can usually make it work. Just remember, your baby grows fast, so you're going to swaddle your baby for as long as they stay in the swaddle. It's okay to put the baby to sleep in a swaddled blanket around them as long as it's not a loose blanket in the crib with them. But once they can kick out of the swaddle, then you're no longer going to swaddle them. And that's usually around the age of 2 months. Some babies are able to kick out of it sooner. So if they are, then you're going to no longer swaddle them. We also do have these sleep sacks that they're called Halo Sleep Sacks, and they have these little wings that will actually allow you to swaddle your baby, and they're attached to this gown. So if your baby really likes to be swaddled and they're not turning over and they just really like that comfort, then you can use one of these sleep sacks. So it's sewn together at the bottom, zip top to bottom, and then when you get the baby in here, you're going to use kind of the same procedure, and then it has Velcro, and it will Velcro and stay put around the baby. So I'm just going to show you how to swaddle using a regular large receiving blanket, and you are going to do this down on a table, but so that you can see, we're going to pretend that I am the table and I am laying this blanket on the table that you're going to be swaddling your baby on. So here in the hospital, that's that hospital bassinet that the baby will sleep in. At your home, just anywhere that's like the changing table or any kind of firm, flat surface, as long as you're there and you don't leave the baby, like Stephanie said, you never turn around and walk away. So you've changed your baby's diaper, and now you're ready to swaddle. You take this blanket and you turn it. It's a square now. You're going to turn it like a diamond and fold that top corner down. And where that nice little flat line is at the top now, that's where the base of your baby's head is going to go just above that. I don't know how easy it is to see, but that's where my baby's head is resting, just above that fold that I made in the blanket. Okay, so remember, your baby's laying down, and you're going to fold your baby up in this blanket similar to folding up a burrito. So we talk about having our baby burrito. So you're going to take one side, it doesn't matter right or left, take one side of the blanket, kind of roll the baby up a little bit and tuck that side of the blanket under their back, and then roll them back to their back, and they'll lay on that part of the blanket that was folded under. And now you're going to do the bottom of the blanket and fold it up. Now you'll notice I have a lot of extra blanket here. I certainly don't want to cover my baby's face. So I have two options. I can either just fold it down, or if it's not too tight, I can tuck it into the top of that swaddle. I find that it's easier just to fold that so that it's not covering the baby's head. And then I'm going to finish up the swaddle by tucking this other side of the blanket. Okay, so I'm going to roll my baby up on this other side and just tuck that nice and snug behind the baby. All right, so you can kind of probably see that it looks like I have a little burrito with my baby's head at the very top. And so they're nice and snug. This is one way also to soothe your baby. So if the baby's crying and mom has fed the baby, changed the diaper, maybe the baby is a little bit sleepy and needs just that kind of comfort of being swaddled to be able to soothe, to go to sleep. So if you can swaddle your baby, you'll be ahead of the game. And then, oh, my baby's mouth is covered because I was not looking at the front of my baby. So make sure the baby's head, the mouth and nose are not covered with the blanket. Some babies will start trying to get an arm out of that swaddle. You notice every time you go to pick them up from a nap, they've got an arm out of the swaddle. If that's how they prefer to be in their swaddle and they're asleep and they're comfortable, then you'll start knowing, okay, maybe we need to leave this arm out of the swaddle because they're going to get it out anyway. And that's totally fine. I always start with just assuming that they want their arms in, so they're almost straitjacketed in there. And then if they get their arms out, then that's fine. And you can continue to swaddle them like that. So for burping your baby, we like to burp babies before we feed them, so before the feeding even starts, because sometimes as they're laying in bed, their bellies will fill with a little bit of air. If there's air in there, when they start eating, they're not going to feel as hungry because their stomach is already full of air. So burping can be a good thing to do. You don't have to do it super long for minutes on end. Just give the baby a few firm pats on the back is how we're going to burp the baby. But you might think of burping the baby as just holding the baby right here and giving some firm pats on the back. You also want to make sure that you have a burp cloth every time you burp your baby, because sometimes with that air coming up, a little bit of curdled milk will come up with that as well. They'll spit up, and that's pretty normal. The thing about holding your baby here and burping is that at first, like we talked about earlier, they can't fully support their head, and their head will kind of bob around and might get kind of buried in your shoulder. So this is a great burping position for when your baby is older and has good head support. So you would have a burp cloth kind of going over your back, because that's where their mouth is. That's where all the spit up is going to go. You'll find here in the hospital, as we're burping the baby, if you're if a nursery nurse or a lactation consultant or someone comes in to help you, we actually prefer to sit down, and hopefully you'll be able to see me. Okay, we like to sit down with the baby and support them on our lap. So we take our hand and support that jaw, so not up under the soft tissue of their neck. We don't want to choke them, but just around their jaw, and we kind of sit them on our lap and lean them slightly forward and just give nice firm pats in the middle of their back. And then sometimes they'll burp right away, and sometimes they won't. Once mom is ready to feed, then you can pass the baby off to mom for feeding. And then the third way that we will sometimes burp the baby is just laying down on our lap. But again, don't forget about the burp cloth. So if you're sitting the baby up on one leg to burp, make sure to have a burp cloth on the other leg. Otherwise, you'll end up with spit up all down your pants and your shoes. It's similar to that if you're laying the baby on your lap to burp, nice firm pats on the back. And then again, remember to support their head. Otherwise, their head will go flopping down. And then make sure you've got that burp cloth. So it's pretty simple. You're not slapping the baby like back blows like we talk about in infant safety and CPR. You're also not just barely touching their back. You're going to give some pretty firm pats on the back. So you'll see the nurses doing this, and that will give you a better idea of about how much pressure to use when burping your baby. Okay, so any last questions? Thanks, guys, for sticking with us.
Thank you guys for coming. We apologize we went over, but we find that dads really want to see those skills just one more time other than what you get in baby care. So if you want to see them again, you can join our baby care class. We had a couple of questions. Where do we get the t-shirts? And I think they were talking about the blanket. What's the blanket called again?
Oh, this is a Halo sleep sack. So Halo, like an angel, H-A-L-O, sleep sack. And then, yes, the t-shirt, like Stephanie showed, the white t-shirt that has overlapping collar. We have those here in the hospital for the baby. You'll still need an outfit to take the baby home in, but you'll find that most of the baby onesies and baby sleepwear and most of the baby clothes are made with like an overlapping fabric right here, an overlapping fold, so that when you pull it over your baby, you're going to gather it like Stephanie mentioned and pull it over instead of actually dragging it over the baby's face. So most baby clothes in the stores are sold made with that in mind, knowing that babies' heads are pretty big.
Okay, I don't see any other questions. So we wanted to thank you guys so much for being here. I'm glad that it was fun. I'm glad. Good. That's so good to hear good feedback. So thank you guys for coming. We apologize for the few minutes over, but we hope that you enjoyed the skills. If y'all have any questions that you want us, we're going to leave you up for a few seconds afterwards just to make sure we got all questions. This is our class evaluation. You will get it emailed to you, or you can hold your picture phone over it and do it now if you'd like. The next baby care class is, I believe, the 27th of June.
Yes.
And then that is
Baby
at
care's at
11:30. Anything else? Okay. Thank you guys so much. And y'all have a good evening. Please make sure you fill out the evaluation either now or when you get the email. We would love to hear from you.
Thanks, guys. We appreciate it. Congratulations.